Sciatica emergency. Can sciatica ever become an emergency? The answer is yes. When sciatica turns into Cauda equina syndrome, that is an emergency and you need to get to the accident and emergency department at the hospital. Have you ever had sciatica, that sharp shooting pain down your leg? Most causes of sciatica are painful but manageable. However, in rare cases, sciatica can suddenly progress to a serious medical emergency called Cauda equina syndrome. Cauda equina syndrome occurs when a large disc herniation or other problem compresses the bundle of nerves at the base of the spine. These nerves control your legs, bowels, bladder, and sexual function. Unlike regular sciatica, this condition is a true emergency. So to recap, this here would be the model of the last two bones of the lumbar spine. This would be the disc, the bones. Of course, you have the spinal cord running through the spinal canal here. Now, the actual spinal cord would actually end a bit further up, and then you will have the cauda equina, or the nerve bundle that comes off the spinal cord, and that would pass through the spinal canal. So let's say this yellow here would be the cauda equina. So this here is a healthy spine. This cauda equina, it is free to move. There's no compression. The nerves exiting, they are free with no compression. Now let's say there's a disc herniation. So in this model here, you can see there's a ruptured disc, there's some herniation, and now this potentially can begin to touch the cauda equina in the spinal canal. Now let's just say this hernia is enough where it begins to compress the cauda equina like that. So when the cauda equina is compressed in this fashion, that there is a neurosurgical emergency and you need to get to the accident and emergency department. In cauda equina syndrome, the warning signs are very specific, so you need to look out for these red flags. The first one will be saddle anesthesia. So in saddle anesthesia, there's numbness in the saddle area, that is around your groin, the inner thighs, or the buttocks. There will also be changes in the bowel and bladder control. These changes are difficulty in urinating, as well as fecal incontinence or even constipation. And there can also be weakness or numbness in both legs. So when it comes to the weakness and the numbness in both legs, once again, these nerves that exit the spinal canal, these will supply the legs. So as you can imagine, if you compress the cauda equina, both nerves would be affected, and then you will begin to feel numbness and weakness in both legs. So that is another red flag in the case of cauda equina syndrome. That is when sciatica turns into an emergency. If you have back pain or sciatica along with any of these symptoms that I just mentioned, do not wait. You need to get to the emergency room as quickly as possible. Early treatment can prevent long-term complications. The long-term complications would be loss of the bowel and bladder control, possibly resulting in you having a urinary catheter in for the rest of your life, or even permanent leg weakness. In cauda equina syndrome, time is of the essence. The longer there is compression of those nerves, the more serious your complications are going to be. Other possible causes of cauda equina syndrome would be spinal infections, tumors, or fractures. These conditions ultimately are going to lead to compression of the cauda equina, leading to cauda equina syndrome. However, the most common cause would be a very severe disc herniation. If you are suffering from sciatica or suspect you have sciatica, you can WhatsApp your X-rays or MRI reports to 747-5297 or 308-3370, or you can book an appointment to see a doctor and or do therapy. We are located at number 4 Chincuna Gardens in Chincuna Road in Cunupia.